we are facing a great challenge of caring for a patient with COVID-19, we as healthcare professionals need to protect ourselves while taking care of a patient. In this video, we are going to demonstrate the use of personal protective equipment while caring for a patient with COVID-19. It's very essential that we protect ourselves and we use the PPE appropriately. At the same time, we need to use it very judiciously. Let's begin the video now.
Now we would see the doffing of PPE. Doffing is to be performed in a designated doffing area. The doffing area is considered to be a contaminated area. The front portion of the used gown, the apron, the outside of the gloves, outer surface of the face shields, front portion of the mask, these are considered to be contaminated surfaces. The articles needed for doffing. We would need a pair of clean gloves, alcohol-based hand sanitizer, a clean chair, closed container with disinfectant swabs, scissors, appropriate colored dustbin with cover. Coming to the preparation. Before leaving the patient room, inspect yourself for any visible contamination. If a visible contamination is present, it is wiped with a disinfectant. A trained observer should be available in the doffing area. The healthcare worker should enter the doffing area only when the trained observer indicates. First is the visual inspection by the trained observer. The observer looks for any contamination. If it is present, the contamination is to be disinfected by a disinfectant swab. Next is removal of the apron. The apron is removed by pulling it outward. It is to be rolled outward so that the inner non-contaminated surface is only exposed. Next is disinfection and removal of the outer gloves. The outer gloves is first disinfected. For removal, pull the gloves of one hand from outside and remove it carefully so that the inner gloves are not damaged. Once one hand glove is removed, roll and place in the second hand. Now remove the outer gloves from the second hand by inserting your finger in between the outer and inner gloves. Remove the glove such that this glove now covers the already removed glove. Discard. Disinfect the inner gloves. Next is removal of the gown or the suit. Unzip the suit and pull it away from your body. Be careful not to touch your inner scrubs. Roll the gown or the suit such that only the inner surface is exposed. Discard. Again, disinfect your hands. Next is removal of goggles. The goggles are removed by pulling it away from the face. Disinfect hands. Remove the shoe cover. Sit on the chair. Remove the shoe cover from one leg carefully so that you do not touch your scrubs or the other leg. Repeat with the other leg. After removal of the shoe cover, disinfect the shoes with swabs. Disinfect your hands. Next is removing the N95 mask. Remove the N95 by pulling out the lower strap over your head. Now pull the upper strap over the head and keep it taut so that it doesn't touch your scrubs. Disinfection of hands. Next is removing the inner gloves. After disinfection, follow the same procedure as for the removal of outer gloves. Disinfection of hands. If you are wearing any extra Next is visual inspection for any contamination. If the trained assistant is convinced, you are ready to exit the doffing area.